here we have our second model of the morning. And she's not had a peel before, okay? So she's been prepping her skin, but as is very normal with clients, they often come in and say, I haven't used my prepping products quite as much as I normally would, as I would like them to. So we've talked through, she's very comfortable to have a peel, but we're just going to do a very quick, gentle 20% glycolic peel, okay? So she's had 2 weeks exposure to glycolic, but not as much as I would have liked. So I'm not going to leave it on for 5 minutes. You can see that she's got a combination skin. You can see she's got a little lesion there. So we're actually not going to treat that lesion because, if you don't mind me commenting, she has picked at it this morning. Okay, so we're going to give some patient advice on leaving our lesions alone. The other things that you need to talk to with your clients before they or your patients before they have their peels is other lifestyle things. I've had clients come in for a peel immediately after having had a hair colour. So that raises a question in your mind. What chemicals have they got on their skin? And if they've got chemicals on their skin from a hair colour, you don't want to be putting a peel straight on. Likewise, if they've got a day planned to be luxurious and they're having a peel in the morning and going off and having a hair colour done in the afternoon and they've only just had a chemical peel, that's not really a very good idea. We need to be careful with jewellery as well, okay? Cheap jewellery can be affected by glycolic peels, so always ask your patients if they've got cheap jewellery on. Okay, please, don't do that. Don't ask if they've got cheap jewellery. Please just ask them to take their jewellery off. So I'm just going to ask you to remove your earrings. I'm ready to apply the peel now. So obviously we've got a very sensitive skin, a much younger skin than the previous peel. So I'm going to apply the 20% glycolic, but it's going to be on for, as I said, a maximum, absolute maximum, excuse me, of 2 minutes. So timer's ready. We're going to apply exactly the same way as last time, but I'm going to keep talking as we go. So when this goes on, you're going to feel it tingling as it's on. Don't be worried by the tingling, it's perfectly normal. Okay, if you don't like it, we will neutralize it straight away. So that's going on. That's great. So you can see actually applying the peel is incredibly simple and easy. We provide brushes for you. These brushes are lovely. You can apply peels various different ways. Some people will use cotton buds, some people will use gauze. I find these brushes very good because you get a very, very even coverage of the peel and no splashing, and you don't waste peel. You're not finding that actually you need 5 mils to apply rather than just 2. So how is that feeling now, my love? Tingling? It's feeling tingling. On a scale of 1 to 10, with 2 being it's itchy and 8 being ouch, where are we?
5.
About 5. Okay, so 5 is absolutely fine. 4 or 5? Okay. I'm watching very closely to see that we don't get any red patches coming up, looking for that epidermolysis as well. And everything is going fine here. How's that feeling? It's tingly and stinging. Still about 4 or 5?
Yeah.
Yep, okay, so it's not increasing beyond 4 or 5. If she started to say it was going to 6, I'd be talking to her, trying to give her some reassurance and looking at whether we need to neutralise. So we've got about 30 seconds left to go, and then we're going to start to neutralise. Okay, so we'll put the eye pads on now. So just keep your eyes closed for me. So these are just dampened cotton pads. We'll just stop any of the neutralizer spray going into her eyes. Okay, so spray coming. How's that feeling? So you can see that whiteness there, that's really satisfying, all the white here showing that the acid has been doing its job and that we're neutralising it now. Okay, so I'm just going to go over your nose and mouth. So obviously this is the first time you've done it, so it's going to make you jump when I spray. So what I want you to do is take a big deep breath in, and now I want you to blow through your nose, and I'm going to spray over your nose. There we are. Always makes people jump, that little bit there, but it's so important to make sure that you're neutralising properly. I'm afraid there is no shortcut to that. Okay, and once more, just over your nose and mouth. Breathe in for me, and breathe out. Well done, that's brilliant. And now breathe normally through your nose or your mouth, it's absolutely fine. Okay, and we're just going to go around once more and make sure that there's nothing that shouldn't be going on in terms of failing to neutralise. That's absolutely fine. So there we are, we're all done. So now we're going to put a cold compress on. Okay, so after the peel, you want to put some nice products on the client's skin. Remember with glycolic, it's a bit like looking after your lawn. If you come along and you pull all the moss out of your lawn and you don't feed the lawn, then you're going to kill the grass. Whereas if you weed and feed the lawn, so you're putting in fertilizer as well, that's great. And glycolic is a bit like that, because glycolic is going to resurface the skin, but we also have a lot of evidence of neocollagenesis, improved hyaluronic glycosamine glycans in the skin post-glycolic. But post the peel, because the peel is a stronger glycolic than they'll be using in the home care products, we want to put other things back into the skin. So I've used a bionic serum. Bionic serum is 10% lactobionic acid, which is the third generation hydroxy acid, which is very, very humectant. If you want to see any clinical studies on that, do come and see us on our stand Aesthetic Source at the front of the show. You'll find us there. We've got the clinical studies to back up the science. Lactobionic acid is actually a really interesting ingredient. It's used in the US by the transplant teams because it's such a powerful metal chelator, such a powerful antioxidant, that they wash the organ out with a wash that includes lactobionic acid in the transplant process. And then to finish with, I've used Daytime Protection Cream, which again comes from the Neostrata Restore range. So based on poly and bionic hydroxy acids, a very, very gentle humectant cream with SPF in it as well. So we've got protection there. The SPF on this is 23, so it's not enormously high. If you want to look for a higher SPF, come back and see us in about 2 months' time, and we will have a fluid SPF 50 coming that you'll be able to use. That's a physical block, so it's no chemicals in there. It's a physical block, SPF 50 for post-treatment use.
Thank you
very much.